Hello, and thank you for tuning into the Minnesota Department of Health Stroke Coordinator 101 training. This training is developed and presented by Stroke Coordinator Jen Wells Pittman and the MDH Stroke Program. The training is broken up into 3 modules. Module 1, Stroke Coordinator Roles and Responsibilities. Module 2, Certification and Designation. Module 3, Quality Improvement. Upon completion of all 3 modules, you can access a link in the video description to complete a survey for 1.0 contact hours. Please reach out to the Minnesota Department of Health Stroke Program with any and all questions. Thanks so much for all you do and enjoy this training series to support you in your role. I will now turn it over to Jen.
So this is the second of 3 modules, and this module is on certification and designation. Our objective is to understand the stroke system designation levels, requirements, and how to prepare for a successful application and site visit. So what exactly is a stroke center? A stroke center is a designated or certified stroke center that adheres to stroke clinical practice guidelines to provide the best evidence-based stroke care and to provide a standardized approach to stroke care and improve patient outcomes. So really putting the patients at the center of everything that we're doing with evidence-based care. So there are 4 different levels of designation or certification. So we're kind of going to go through these, and throughout this presentation, you'll see things kind of broken up into these buckets. So acute stroke ready, these are a lot of critical access hospitals and typically smaller hospitals with lower volumes. They can give the IV thrombolytic, but many of them will transfer after to a higher level of care. Then we move up to primary stroke center certification. These are usually a little bit bigger. They can give the IV thrombolytic and they typically keep those patients. They may or may not have neurosurgical capabilities, but typically they're able to care for the vast majority of their patients that they receive. They also will receive patients transferring in from other acute stroke ready hospitals. The third level is called PSC Plus or thrombectomy capable, depending on which certification body you're using. So these ones will have neurosurgical capabilities, advanced imaging, they have thrombectomy capabilities, they may be receiving transfers from both acute stroke ready and primary stroke centers as well. And then comprehensive stroke center is the highest level of stroke certification available. They typically will have a neuro-designated ICU, the full spectrum of care, 24/7 capabilities for neurosurgery, thrombectomy, advanced imaging, carotid artery stents, CEA capabilities, etc. And they will also receive transfers from the other levels of certification. A lot of times you'll also see these kind of in a hub and spoke model where you'll have comprehensive center kind of in the middle of the hub and then kind of branching out to the primaries who may be also accepting from the acute stroke readies as well based on their regions. So there are multiple certifying bodies who designate institutions as stroke centers. So the Minnesota Department of Health does the acute stroke ready designation. That is a 3-year cycle for application submission, and the on-site visit that is every 3 years. The Joint Commission is another certifying body. They will do acute stroke ready, primary, thrombectomy capable, and comprehensive. They have a visit. They have an on-site visit every other year. It's typically about a 90-day window with a 7-day notification of when they'll be on site. And then on the off year, they're doing a virtual meeting or call that is pre-scheduled to go over some of the information for your program as well. DNV is another certifying body. They have acute stroke ready, primary, primary plus, and comprehensive. They have an on-site visit every year, and that is pre-scheduled. And then there are a few others that aren't as common that certify as well. The designation cycle does vary a little bit based on which accreditation body you are using, but in general, this is kind of the cycle that we're going to talk through. So step 1 is your designation, application, and submission. Then you're going to have your site visit preparations and site visit kind of part of the cycle. The third step then will be your immediate action plan. So that may be called citations or deficiencies or opportunities, depending on which accreditation body you're doing. So if you have any gaps in your program that they've identified, that's kind of step 3 is going through those and addressing those. Step 4 is really the bulk of your program that you're going to be doing. So program management, quality improvement, that's kind of going to be the longest section in your designation cycle. And that's going to be kind of in between each of your visits. So depending if you have a 3-year visit, every other year visit, or a yearly visit. And then number 5 is really getting ready for that next round of designation. So it's kind of a constant loop that we're going through. So let's talk about step 1 a little bit more. So this is kind of the beginning of your designation cycle. It's going to be your application submission. So each accrediting body does this a little differently for what you need to submit for your application and then when that occurs. So really being aware of those timeframes for submission, making sure you're looking at the application details and filling that out completely. It's super helpful to review previous applications and previous site visit findings while you're doing this process as well. Gathering all your current documents. So if you have an internal website that you have everything on, that's really nice to have because then it's easier to make sure that everything's up to date. And then also making sure that anything that you do have online that you're reviewing yearly or every other year based on your institution's recommendations to make sure that those stay up to date as well. You want to engage any stakeholders needed early as to make sure that your application is ready to go. So if you start it and then you have questions, you can pull in your stroke medical director or other people to help answer questions that are needed on your application. And then you want to make sure that you're submitting your documentations and stuff within the set timeframes. When we look at preparing for our visit, we're going to be collaborating with other stroke coordinators throughout the healthcare system and share resources if possible. Help support each other with the on-site visit, whether that's being on-site there or being available via like Teams chat or texting or emails during the visit in case questions come up, and then sharing resources and documents as well. If you're able to develop tracer, or you're sharing those across your healthcare system or using them specific for your site, that's super helpful. It helps kind of guide what areas need to be aware of to prepare their staff. You can use those to also do mock stroke tracers in the area to help prepare staff. So maybe you have a list of questions that are commonly asked in the ED. And so then you're gonna do in-person tracers where you go to the emergency department with the questions, you're going to the front desk and asking the check-in people and your triage people the questions, and then kind of moving through how it's going to look for a site visit. You want to make sure that you have a contact list of the different areas and who those key people are and who their backup is. So if you know that you're having your site visit on a specific day and that person's going to be away, who can you contact instead? So if you're needing a tour through the ED, maybe you're using your ED nurse manager. You want to make sure you're keeping that up to date and then make sure it's up to date prior to your visit and really keeping those people informed of your visit preparation plans. You also need to look at the agenda. Most of the accreditation bodies will have a kind of a pre-planned agenda for you. And so then you can kind of really look at it and decide who needs to be at each session, where are you holding each session, what rooms need to be reserved, do you have any IT needs for those sessions so you have people that are going to be on virtually, and then really identify and review all the available resources. So if you're Minnesota Department of Health Acute Stroke Ready, you're going to be going to their website and really looking at all the resources available to help prepare you for your visit and in your accreditation cycle. So this is just an example of what you might look at for a tracer. Once you've been in your role a while and you've gone through a visit, or maybe you've gone and watched a visit at another healthcare system near you, it'll kind of give you an idea of what people are asking, what things that they're looking for, and really help you prepare for another visit. So you might start a document that has questions for each different area or role. So maybe one of your questions is, how are you alerted of a stroke patient coming into the emergency department? So is that via an overhead page? Are you using pagers? Do you have lighting systems, some way that you're alerted of these patients? And then make sure that the staff, are they answering it correct or not? And that will really help guide if you need further education stuff in those areas as well. So these are just some example questions of things that you might be thinking about. Really tailoring the questions to each area. Consider any practice changes or changes in standards. previous citations. Anytime that we've got a citation in something, I really try and reinforce those practices again prior to the visit so that's fresh in their minds. Re-going through any current gaps, and sharing this stuff with the area so that they can help prepare themselves as well. So as a stroke coordinator, you're typically a party of one, and sometimes it's very overwhelming to think of all the different areas and different people and roles that you need to get ready. So really encouraging those areas and empowering them to kind of own some of this and be able to do that with their staff as well. The Minnesota Department of Health does have a tracer online that you can look at to help focus your efforts in for those acute stroke ready site visits and tracers as well. So this is just an example of a contact list. So just making sure that you have the key people listed and then who to talk to if they know they won't be there for the visit. And then just keeping them updated of the visit needs. These are typically the people who I would send the tracers to and updates on when the visit is. And then afterwards, it also helps because you've got your list of people who you're going to pull together if you get a opportunity for improvement. So when we look at agenda planning, again, most certifying bodies will have some type of agenda template for you. There is one on the Minnesota Department of Health site. I know DNV and Joint Commission both have ones that they'll give you as well. So acute stroke ready and primary are typically 1 day with one reviewer. Thrombectomy capable or PSC plus are typically 2 days with one reviewer. And then comprehensive is typically 2 days with 2 reviewers. So you can see how this kind of grows as you move up the different levels of certification. What I like to do is I have 2 agendas. I have the short one that I give to everyone who's involved, and that's going to be a little bit more simplified. And then the longer one, which is going to tell me everything that I need to do to prepare for those different sessions. So this might be what your short agenda looks like. It might have your times on it, what presentations or what areas or what things you're going to be working on, and then it's going to have the location of where those are going to take place. So if I know we're doing tracers for an hour and these are typically the areas we're going to do, I'm just going to let people know so they're aware. If we're doing the opening presentation, I'm going to have the whatever lecture hall or room we've reserved and let the people know who are coming to that. So this is just the really short, very clear agenda for the day. But my agenda might look a little different. So I'll have a long agenda that's going to tell me exactly what every person needs to be, what we might need, if we're getting snacks or lunch for the reviewers, and then where these things are taking place. So I might know that I need to go greet the reviewer and it's going to be stroke coordinator Sally and stroke medical director, Dr. Brain. And so I want to make sure that I've got my attendees clearly listed. I might know that we're going to meet the reviewers in our entryway. We want to make sure that security and the entry staff desk know that they're going to be coming in case they get there before we do so that they can have them kind of wait to the side there. Oops. For the opening presentation then, I might have the list of who is all coming. This might be a short list or a long list. I might want to say if we're doing an actual slide presentation, who's presenting which slides. I might want coffee present. Ensure the room is tidy because I know that we use that as a break room too or something. If you're doing a Teams link, make sure that's on and ready. So really putting in all the details of everything that you're going to need. For your planning session, you might want notebooks, pens, or scribe sheets, the patient lists of patients that are currently there or recent lists. We might want laptops for everyone so people can help kind of plan out where we're going. And then same with tracers. We might want to make sure people have laptops to help look patients up when you're doing chart reviews, making sure we have the patient lists and stuff as well. So as you're going through your full agenda, having a long agenda that really goes through everything that you as the stroke coordinator needs to be aware of. So then the exciting part is when you have your actual site visit. This can be very stressful and scary, especially if it's your first one. But remember, you're doing this so that you can improve your program. And even if you get citations, that's not a bad thing. It's really helpful to have these reviewers come in with a second set of eyes they're looking at your program from a different view, and they're really able to help kind of give you some ideas as well. So once you know your date, you want to make sure that you're notifying your contact people and sharing with the areas. Again, know who your backup are if people can't be there. You're going to be looking at your current patients and reviewing those and providing feedback, and then updating any presentations if there's any specific presentations that you need to do. The day prior to the visit, I like to look at all the current patients, the recent patients, and get that list pulled together nicely for the reviewers. If you have helpers or scribes who are going to be helping, who may not be as familiar with the different areas, or they're going to be kind of in your a central area who may be able to run and grab things for you, sometimes it's nice to take those people just on a quick tour of, here's where we might be in the ED. When we move to CT, this is where we're typically going to be on the units, so that they're aware of those things and can help with those as well. On the day of the visit, take a few minutes for yourself. You're going to do great. You're going to meet your reviewers, focus on the positives, the opportunities, and suggestions. When these reviewers are there, they have been to multiple other sites and different levels of certification in different areas. If you're PSC or CSC, they're going to have gone kind of across the country looking at different institutions, so they can have great suggestions for you. And this is a really good opportunity to say, hey, we're really struggling with our door to CT time. What have you seen other areas do? And they will give you a whole list of suggestions that you can then take back and really see if any of those would fit with your program. So at the end of your visit, you're going to kind of get your opportunities. So they may be called citations or deficiencies. Everyone kind of calls them a little bit different. So you really want to take that time to dive into what the issue is. So is this a local issue where it's just in one little area? Is it more widespread across multiple areas, and identify that right away? You want to gather your key stakeholders, including end users. So we're really good about pulling leadership together, nurse managers, tech leaders, but we really want to make sure we're pulling those end users in as well. So find that EDRN, find that CT tech, and have them look at the processes with you. So you're going to review what citation you got in detail. You're going to discuss barriers to success. So what maybe were the issues that caused that defect to happen? Look at any baseline data you have available. So sometimes you may get a citation and you look at your data and you're like, oh yeah, we knew this might be an issue. We've got a lot of gaps here that we need to work. And sometimes your baseline data might be really high and they just happen to pick a patient who had a defect. And so that's going to kind of guide what type of action plan you're doing as well. You want to identify short and long-term solutions to your issue. A lot of times you're going to have a time frame that you need to complete your citation in. So that's going to be kind of your short-term goal. And then your long-term goal may be, how is this more sustainable? Are there more things that you can implement with your medical record that would take longer than your time frame to implement? And make sure that you're really aware of your time frame for initial completion and submission and what is required. So for some of these, they might say, okay, by your next visit, we want you to have this done, but initially you do need to do this one as well. Whereas others have a certain time frame that you have to have everything fully implemented in. So make sure you're really aware of what that looks like. And then also helping to identify an owner. So as the stroke coordinator, you're obviously going to be kind of overseeing all of these different citations you might get, but really try and identify an owner in that area too that can help do some of the follow-up interventions, data, and help with some of that stuff too. Once you've completed all your interventions and education, you're going to submit your plan back to your accrediting body. And you really want to make sure that you're tracking ongoing compliance and data. So a lot of times, maybe you got a citation on your stroke scale not being done in the ED on time. And so you're going to make sure that you're tracking that over time and making sure that with this initial push, you're getting to your goal, but that's maintained and has been fully integrated into your practice. After you've kind of finished your initial action plans, then you really want to think about those ideas and suggestions that the surveyors may have given you as future projects to consider. So look at those things that they've told you. You might be looking at PDSA cycles to increase compliance or change things, and we'll discuss that a little bit more in Module 3. You might want to consider doing a monthly scorecard for each citation and project, and color code it for quick reference so you can see which ones are already meeting the goal and which things you need a little bit more work on. really considering those areas, owning their findings and sharing those with your stroke work group or stroke team. And then make sure that you're celebrate your success. So you finished your visit, you made it through, you got your certification, and now you need to review and stay on top of best practices. But just getting through the visit and supporting your team through that is a big thing to celebrate as well. When we look at our next part of our designation cycle, that's really going to be on your program management and quality improvement items, and we're going to be focusing on that in Module 3. And so then step 5 would be getting ready for your next round. So step 4 is really when you're looking at a lot of those suggestions the reviewers gave you, seeing if those are things that you can implement, benchmarking with other institutions within and outside your health institution to see what other items may be coming forward and how to improve care. And then also reviewing the clinical practice guidelines set forth by the American Heart, American Stroke Association. Those are released kind of randomly, so you kind of need to kind of pay attention and look at those now and then to see if anything has been updated regarding those, because those are really going to help guide your practice. Okay, so I'll hand it back over.
Great. Yes, thank you, Jen, for all the great information. If you're looking for further designation resources, we have a plumb full list of resources here. You can visit the MDH Stroke Program website where you will find further information about the stroke system in general and also the designated hospitals throughout the state and their levels. The next resource or website is also is the resources webpage, which houses all those individual clinical resources to support you specifically if you're in acute stroke ready. There's lots of templates, agendas, samples to support you on that site visit that Jen spoke to. Great. Well, so thank you for tuning into Module 2 of the Minnesota Department of Health Stroke Coordinator 101 training. Upon completion of all 3 training modules, you can access a link in the video description to complete a survey for 1.0 contact hours. Please reach out to the Minnesota Department of Health Stroke Program with any and all questions as you are going through these modules. Thank you for all that you do, and I hope you are enjoying this series to support you in your role.